Your blood pressure is still high. You have reduced salt, started walking, tried to lose weight, and perhaps you are already taking medication. Yet every time the cuff tightens around your arm, those numbers remain higher than they should be. Most people assume this means they have not worked hard enough or that high blood pressure is simply an unavoidable part of getting older. But that is not always true. Sometimes the pressure remains elevated because the real driver is somewhere else entirely inside your hormones, your kidneys, your sleep, your medicine cabinet, or even a product labeled natural. And until that hidden driver is identified, adding another restriction or another medication may not fully solve the problem. Today, I am revealing 7 commonly overlooked reasons blood pressure can remain stubbornly high. We are counting down from number 7 to number 1, and the final cause is especially important because it may begin years before routine blood sugar results become abnormal. Stay until the end, because I will also give you a simple checklist to help you recognize which of these possibilities deserves a conversation with your healthcare professional. I'm Dr. Robert Hale, and let's begin. Hidden cause number 7. Your thyroid may be out of balance. Your thyroid is a small, butterfly-shaped gland located at the front of your neck, but its influence reaches almost every part of your body. It helps regulate metabolism, body temperature, energy use, heart rate, and the way your blood vessels respond. When the thyroid becomes underactive, many processes begin to slow down. You may feel unusually tired, cold when everyone else feels comfortable, constipated, mentally foggy, or unable to lose weight despite eating carefully. Your skin may become dry and your hair may thin. What many people do not realize is that an underactive thyroid can also contribute to blood vessel constriction, fluid retention, changes in cholesterol, and higher blood pressure. An overactive thyroid creates a different pattern. Instead of slowing the body, it accelerates it. Your heart may beat rapidly or irregularly. You may feel anxious, overheated, shaky, restless, or unable to sleep. In this situation, the top blood pressure number may rise because the heart is pumping harder and faster. Both conditions can therefore lead to pressure that seems unpredictable or difficult to control. The symptoms are frequently dismissed as stress, menopause, poor sleep, or ordinary aging. But when several of these signs appear together, the thyroid deserves attention. A TSH test is commonly used as the starting point for thyroid evaluation. Depending on your symptoms, medical history, and initial result, your clinician may decide that additional thyroid testing is appropriate. The important point is not to diagnose yourself from a symptom list. It is to recognize that a hormone problem can sometimes sit underneath a blood pressure problem. Thyroid disorders can affect heart function, blood vessels, fluid balance, cholesterol, and blood pressure. Hidden cause number 6. A natural product may be working against you. Many people carefully report their prescription medications, but forget to mention powders, teas, herbal blends, fat burners, pre-workout products, or energy supplements. They do not consider these products to be medicine, so they never appear on the medication list. But your arteries do not care whether an active ingredient came from a prescription bottle or a plant. If it stimulates your nervous system, alters fluid balance, interacts with medication, or constricts blood vessels, it can affect your pressure. Pre-workout powders and energy products may combine several stimulants. A person may look at the label, see green tea extract or another familiar ingredient, and assume the product is gentle. But a concentrated extract is not necessarily equivalent to drinking a normal cup of tea. Some formulas also contain large amounts of caffeine or stimulant-like ingredients that increase heart rate and vascular tension. Certain herbal products deserve caution as well. Licorice root, bitter orange, ephedra-related ingredients, and some forms of ginseng may raise blood pressure or interact with medication. A product can be natural and still be powerful. Poison ivy is natural. Tobacco is natural. Natural does not automatically mean harmless. The risk becomes greater when several products are stacked together. Imagine someone who drinks strong coffee in the morning, takes a pre-workout before exercising, uses a decongestant for sinus pressure, and takes an herbal energy product in the afternoon. Each product may appear manageable in isolation, but together they can place the cardiovascular system under sustained stimulation. Create a complete list of everything you use: prescriptions, over-the-counter medicines, vitamins, herbs, powders, gummies, teas, drops, and energy products. Include the dose and how often you take each one. Bring that list or photographs of the labels to your next appointment. Do not assume your doctor already knows what is inside a supplement based only on its name. Some supplements can raise blood pressure or interact with blood pressure medications, and supplements are not reviewed for safety and effectiveness in the same way as prescription drugs before reaching the market. Hidden cause number 5. Another medication may be raising your pressure. Sometimes the medication used to treat one problem can quietly worsen another. This does not mean the prescription was necessarily inappropriate. It means its effects should be reviewed in the context of your entire health picture. One common example is the group of pain relievers known as non-steroidal anti-inflammatory drugs, or NSAIDs. These include medicines containing ibuprofen or naproxen. They are often used for arthritis, back pain, headaches, and inflammation. In some people, especially with frequent use, they can promote fluid retention, affect kidney function, and contribute to higher blood pressure. Certain cold medicines and decongestants can also be problematic because they narrow blood vessels. That may help reduce swelling inside the nose, but the effect is not always limited to the nasal passages. People with hypertension are often advised to check labels and ask a pharmacist before using particular decongestants. Other possible contributors include some antidepressants, stimulant medications, corticosteroids, hormonal medicines, weight loss drugs, and other prescriptions. The effect varies from person to person. A medication that has little influence on one individual may noticeably affect another. The timeline provides an important clue. Ask yourself, did my pressure begin rising shortly after I started a new medicine, increased a dose, or began taking something more regularly? Did the change occur after I started treating arthritis pain every day? Did it appear after a new antidepressant, hormone therapy, or cold medicine? Never stop a prescribed medicine suddenly on your own. Some medications can cause serious problems if discontinued abruptly. Instead, take your blood pressure record and complete medication list to your doctor or pharmacist. Ask a direct question. Could anything I am taking be contributing to these readings, and is there a safer alternative for me? The solution is not always another blood pressure pill. Sometimes the better approach is to review the entire medication stack and reduce an avoidable contributor under professional supervision. NSAIDs, oral contraceptives, hormone therapies, sympathomimetic drugs, and other medication classes are recognized contributors to difficult-to-control hypertension. Hidden cause. Number 4. Your kidneys may be receiving the wrong signal. Your kidneys are not simply filters. They are also major regulators of blood pressure. Every day, they determine how much sodium and water your body retains and how much it removes in urine. When the kidneys sense that blood flow is too low, they activate hormonal systems designed to protect you. The body retains more sodium and water, blood volume increases, and blood vessels tighten. This response is useful when pressure is genuinely low. But if the kidneys incorrectly perceive low blood flow, the same response can drive pressure upward. This can happen when kidney tissue has been damaged by diabetes, long-standing hypertension, inflammation, or other disease. It can also happen when an artery supplying a kidney becomes narrowed, a condition known as renal artery stenosis. The kidney may interpret that reduced local blood flow as evidence that the entire body needs more pressure, even when pressure elsewhere is already high. The result can become a damaging cycle. Higher pressure harms the kidney's blood vessels. The damaged kidneys become less effective at removing excess fluid. That additional fluid raises pressure further, which causes more damage. Possible warning signs include swelling around the ankles or lower legs, changes in urination, unusually foamy urine, worsening kidney test results, or blood pressure that remains high despite an appropriate treatment plan. However, early kidney disease often produces no obvious symptoms, which is why testing matters. A kidney evaluation may include a blood test that estimates filtration, a urine test that looks for albumin or protein, and, when clinically appropriate, imaging to examine the kidneys or their blood supply. Not everyone with hypertension needs every possible scan. Testing should be guided by your history, examination, laboratory results, and response to treatment. High blood pressure can both cause kidney disease and result from kidney disease, while narrowing of the kidney arteries is a recognized cause of renovascular hypertension. We are now entering the top 3, and these are the causes people frequently underestimate because they have become so normal in daily life. Before we continue, think about your own routine. What enters your body from the moment you wake until the moment you go to sleep? Coffee, medication, supplements, nicotine, energy drinks, and late-night snacks can form a pattern that no single appointment reveals unless you describe the entire day. Hidden cause number 3: nicotine, vaping, and stimulant stacking. Most people understand that cigarette smoking damages the heart, but many underestimate how quickly nicotine can affect blood vessels. Nicotine stimulates the nervous system, raises heart rate, increases blood pressure, and causes blood vessels to narrow. Smoking also exposes the body to carbon monoxide and many toxic compounds that damage arteries and reduce the blood's ability to carry oxygen efficiently. Over time, the inner lining of the arteries becomes less capable of regulating blood flow, contributing to stiffness and cardiovascular disease. Vaping should not be treated as harmless simply because it does not produce traditional cigarette smoke. Many vaping products deliver nicotine, sometimes repeatedly throughout the day. Each use may feel brief, but the cardiovascular system experiences a repeated stimulant signal. Then there is caffeine. Moderate coffee consumption may fit safely into many people's diets, but sensitivity varies widely. Some people can drink coffee without a major pressure change, while others experience a noticeable temporary rise. The larger concern is often not one cup of coffee, it is the total stimulant load. A large coffee in the morning, an energy drink at lunch, a nicotine vape throughout the afternoon, and a pre-workout powder before evening exercise can keep the nervous system activated for much of the day. Each item may seem minor, but their effects can overlap. Try measuring your blood pressure under consistent conditions. Avoid exercise, tobacco, and caffeine shortly before taking a reading. Sit quietly, support your back, keep both feet flat, and rest your arm at heart level. Accurate technique helps separate a genuine pattern from a misleading measurement. If you smoke or vape, quitting is one of the most important actions you can take for your arteries. Nicotine raises blood pressure. Tobacco damages blood vessels, and nicotine-containing vaping has been associated with acute increases in heart rate and blood pressure. Hidden cause. Number 2. You may be struggling to breathe during sleep. You can spend 8 hours in bed and still receive poor quality sleep. Obstructive sleep apnea occurs when the airway repeatedly narrows or closes during sleep. Breathing may pause, oxygen levels can fall, and the brain responds by activating a stress reaction. Instead of remaining in a calm, restorative state, your body repeatedly releases signals that increase alertness, tighten blood vessels, and stimulate the heart. You may not fully awaken or remember any of these events, but your cardiovascular system experiences them. Loud snoring is a common clue, but not everyone with sleep apnea fits the stereotype. You do not have to be severely overweight, and you may not realize that you snore or stop breathing unless someone else notices. Possible signs include waking with a dry mouth or headache, feeling exhausted despite spending enough time in bed, struggling with morning brain fog, becoming unusually sleepy during the day, waking frequently to urinate, or having a bed partner report gasping, choking, or pauses in breathing. Sleep apnea is especially important when blood pressure remains difficult to control, rises during the night, or is unexpectedly high in the morning. The repeated oxygen drops and nervous system surges can keep arteries under pressure during hours when the body should be recovering. Diagnosis may involve an overnight sleep study, performed at home or in a sleep center, depending on your situation. Treatment is not identical for everyone. Options may include positive airway pressure therapy, an oral device, weight management, sleep position changes, or other interventions selected by a qualified clinician. Do not dismiss chronic morning exhaustion as a normal consequence of age. Untreated sleep apnea is linked with difficult-to-control hypertension and increased cardiovascular risk, while breathing devices and other treatments can help keep the airway open. Hidden cause number 1. Insulin resistance may be working before blood sugar looks abnormal. This is the final cause because it can remain hidden for years. You may be told that your fasting glucose is still within range and assume that insulin cannot be part of the problem. But blood sugar and insulin are not the same measurement. Insulin is a hormone produced by the pancreas. Its job is to help move glucose from the bloodstream into cells, where it can be used for energy. When those cells become less responsive, the pancreas may compensate by producing more insulin. For a period of time, that extra insulin may keep blood glucose from rising dramatically. The sugar result can therefore look acceptable while the body is working increasingly hard behind the scenes. High insulin levels and the metabolic changes associated with insulin resistance can promote sodium retention, increase nervous system activity, contribute to inflammation, and occur alongside abdominal obesity, abnormal cholesterol, and elevated blood pressure. This cluster is often described as metabolic syndrome. Possible clues include increasing waist size, strong cravings for refined carbohydrates, fatigue or sleepiness after meals, elevated triglycerides, low HDL cholesterol, fatty liver, prediabetes, or a family history of type 2 diabetes. None of these proves insulin resistance on its own, but together they create a pattern worth discussing. This is also why simply removing the salt shaker may not completely correct someone's pressure. If most meals still contain refined carbohydrates, sugary drinks, highly processed foods, and excess calories, the metabolic driver may remain active. Improving insulin sensitivity usually involves a combination of sustainable weight reduction when needed, regular physical activity, better sleep, more minimally processed foods, fewer sugary drinks and refined carbohydrates, adequate protein, fiber-rich foods, and medical treatment when appropriate. Do not wait for diabetes to become advanced before paying attention to metabolic health. Insulin resistance and prediabetes are associated with metabolic syndrome, which includes high blood pressure and increased risk for heart disease and stroke. Now let's turn these 7 causes into one practical action plan. First, record your blood pressure correctly and consistently. Use a validated upper arm cuff, sit quietly before measuring, and keep a written log rather than reacting to one isolated number. Second, create a complete inventory of everything you take. Include prescriptions, pain relievers, cold medicines, vitamins, herbal products, pre-workouts, energy powders, nicotine, and caffeine. Third, examine the timeline. When did the pressure begin rising? What medication, supplement, habit, symptom, or weight change appeared around the same time? Fourth, pay attention to patterns. Morning headaches and exhaustion may point towards sleep evaluation. Swelling or foamy urine may justify kidney testing. Cold intolerance, constipation, hair changes, rapid heartbeat, or tremor may justify thyroid evaluation. Abdominal weight gain and post-meal fatigue may point toward metabolic health. And fifth, do not change prescribed treatment on your own. Bring your information to a clinician and ask specific questions. Could sleep apnea be contributing? Should my kidney function be checked? Could one of my medicines or supplements raise blood pressure? Do my symptoms justify thyroid or metabolic testing? High blood pressure usually causes no obvious warning symptoms, yet uncontrolled pressure can damage the heart, brain, kidneys, and arteries. That is why identifying the driver matters. Here is The complete countdown, one more time. Number 7, thyroid imbalance. Number 6, supplements and so-called natural stimulants. Number 5, prescription and over-the-counter medications. Number 4, kidney disease or reduced blood flow to the kidneys. Number 3, smoking, vaping, caffeine, and stimulant stacking. Number 2, obstructive sleep apnea. And number 1, insulin resistance that may begin before blood sugar becomes obviously abnormal. Cutting sodium, walking regularly, maintaining a healthy weight, sleeping well, avoiding tobacco, and taking prescribed medication remain important. But when pressure refuses to improve, the answer may not be to try harder at the same strategy. It may be to investigate what has been overlooked. Leave a comment and tell me which of these 7 causes surprised you most. Subscribe to Robert Hale Health for practical, understandable information designed to help you protect your heart, preserve your independence, and make better informed decisions as you grow older. I'm Dr. Robert Hale. Keep monitoring, keep asking the right questions, and remember, a stubborn number is not something to fear. It is information your body is asking you to investigate.